All right, thank you for joining us today for another edition of State of the Virus. And this time we're going to focus on children and the Pediatric Center with a lot of questions between the COVID-19 vaccine and children. We're bringing some local experts to kind of help answer questions that you, the viewers, have. So today we're joined by Dr. Philip Hefner from Guthrie, and once again, Dr. Justin Nistico of Arnett Health. Thank you both for joining us today because, like I said, there's a lot of questions regarding COVID-19, especially with children. So I'm going to start with you, Dr. Hefner. How has the cases been among children in our area when it comes to COVID-19?
Well, I think there are a lot of asymptomatic positives where people have had a known exposure and have been tested in that context and have been, somewhat surprised that they were found to be positive. I think that's the biggest group in children that we've seen. I think there are a lot of school-age children and adolescents with mild symptoms, sort of cold symptoms or gastrointestinal symptoms, because the virus can cause some of those. I personally have not seen or been reported any severe or the MIS-C type cases. I know there have been a few in the region, but they've been extremely few, and that's good. So that's the more severe, the multi-inflammatory syndrome. So overall, I think the news is as we thought. It's not as severe a disease in children, but of course it's contagious from children. So that's a bigger concern.
All right, and then Dr. Nistico, we've talked a lot about the ramp up in vaccinations. How has it been for children? Because we know right now only the Pfizer vaccine is eligible for children 12 and up. So how's vaccination been when it comes to getting those younger kids vaccinated who are eligible?
I think there is a lot of hesitancy amongst a lot of parents that are out there because of the fact that there has been some reported signs and symptoms following the second dose or even the first dose. And so a lot of people have been using kind of the understanding that children don't get very sick with COVID, but yet there is still a concern because it's more of a public health concern, being that if a child is ill with COVID, it can spread to, say, an adult or an older, more vulnerable individual. Vaccinations now with Pfizer have been approved for that 12 and over crowd, but they are still in the phase of trials, phase 2, phase 3 trials of vaccinating 6 months to that 12-month period. And Moderna and Pfizer are both working on looking at the data. It's still kind of in the stages where they're looking and evaluating cases, but there have been lots of reports of different families in the region that are accepting of putting or enrolling their children in these trials just because the data for adults is extremely safe for these vaccinations if you're going to compare COVID-19 infection to actually being vaccinated. Once again, the vaccines have been proven to be highly effective and very safe. So that's why they are moving forward with these trials in children.
All right, Dr. Nistico, what are those trials looking like? We had one parent who asked what kind of trials are done when it comes to these kids, how do people sign up, and when are we going to start to see the younger kids who are 6 months and older? Because I know we kind of talked about before, there's kind of a breakdown in age where you do maybe 10 to 12, then 6 to 10, and you kind of go down further on. So what does that look like right now?
Both Pfizer and Moderna are working on vaccinating these younger children from the 6-month crowd to older up to 12 years. But the thing is, those trials have been enrolling. So the way to enroll children in those trials is there is contact information on websites for both Pfizer and Moderna, as well as they have reached out to some communities and local health departments where you could say, I'm interested in getting my child vaccinated and enrolling them in the trial. How could I go about doing that? There might be some information that they can give you about those particular pharmaceutical companies. The other thing that to note also is that to see how effective and safe a medication or vaccination can be, it could take time. And the reason for it is that we want to vet things very closely for children, especially in situations where, adults, we know they have obviously a fully functioned immune system, and that these individuals that are younger, we want to also make sure that the dosing is correct. The patients that are in the trials haven't had any major symptoms. Nothing has been reported as of yet, and I've looked at both the trials that they're doing. They have reported some symptoms that have been reported in adults, like you might see some mild fever, you might see some achiness and fatigue. They may get very tired for a day or two, but nothing very severe. So nothing life-threatening or severe in the trials. And that's extremely, extremely positive when looking forward to vaccinating younger crowds of children, especially those that are school age. So it's important just to get back to the swing of things where people can go back to that community setting and have children playing in, big settings with other children.
All right, and Dr. Hefner, you kind of talked about you haven't seen a lot of these severe cases among the kids, especially that the extra kind of development in the virus that we've seen across the country with children. So one parent asked if kids aren't getting COVID, quote unquote, that bad, why are we really pushing this shot for them? And how is it kind of different for them when it comes to getting the COVID shot versus the flu shot or any other shots that are kind of mandated right now for children?
Well, I would say this is a public health matter. So when the 12 to 15 group came online, that added 17 million people to the pool as we work towards broader immunity. So it is correct that the risk is lower to the individual child, but the risk is still the same for the community. And so a child who has the virus and is symptomatic and can spread it can easily give it to a vulnerable person who then can become gravely ill. So most immunization strategies are around public health campaigns that, they do protect individuals, but they protect everyone. And most importantly, they allow us to get back to the sort of comfortable interactions that we all have enjoyed and that would have been missing for the last year or more in most of our lives. So, compared to say influenza is a more dangerous illness in younger people and children than coronavirus seems to be. Obviously, we're still learning about coronavirus, but influenza, for instance, has a huge reservoir in young people. So in a year where not too many young people get influenza vaccine, that's not good for the vulnerable people. So there's a parallel between protecting the people you care about and the vulnerable people in our community by being a good citizen and getting your vaccine for the greater good. And I think that is part of the discussion when we talk about coronavirus vaccine is, what are we trying to accomplish in our communities and in our country? And we're trying to get enough people protected so that we can get our lives back.
All right, and kind of going off of that, Dr. Nistico, what role do the kids really have when it comes to getting them vaccinated in achieving herd immunity? We've talked a lot about herd immunity, and we see 50 or 60% of either the state or a country is vaccinated, but those are only, I believe, the 18 plus. So what role do kids have in getting that number up?
It's very incremental. I mean, what we would see is that if children are, say, not vaccinated, it's a huge population of individuals which can be vulnerable, can spread the virus, and so there is opportunity for not only viral mutation but also viral spread, in individuals that are in that population. What I would say is that it's definitely important because when herd immunity is ever talked about, the magic number of whether it's 60, 70, 80%, the higher the better. So if we could vaccinate more individuals in this country, it puts us in an opportunity to eradicate infections that we have seen in the past where measles, the cases of measles have been significantly reduced, or polio, where we had, vaccinated mass amounts of these individuals, including children, which we do now, where we vaccinate children for measles, polio, and we've seen such significant reductions in these infections. Going forward into the future, I think it's extremely, extremely, extremely pivotal that we focus on these vaccinations, maybe in younger children, because it might be that you could vaccinate a child and you might develop that immunity for a really long time. And that might be able to kind of start the ball rolling where we're not seeing outbreaks of other coronavirus infections or mutations. And I think it's extremely important in achieving herd immunity to vaccinate those younger children.
All right, Dr. Hefner, we talked about, as Dr. Nistico just mentioned, the requirements for certain vaccines. Is there a possibility, do you think, that we could see a mandatory COVID-19 vaccine for kids like we've seen with other ones in the past?
I think it's entirely possible. I don't think it's decided. For example, the governor of New York has put forth that folks going to SUNY, State University of New York, and City University of New York campuses in the fall will be required to be vaccinated. That was a bit of a surprise because the vaccine is still under an emergency use authorization. And I think there was some speculation that there would not be a requirement really at any level until there was a formal approval besides the emergency use authorization. So that was an interesting development. And I think that's sort of a precursor. I think it's challenging to require school-age children to be vaccinated for anything when it's under either an emergency use authorization or the vaccine's not available to all of those school-age children. But I think in time, maybe not this fall, but perhaps fall a year forward, it's entirely possible that if the vaccines have received complete approval, that New York, which has a school vaccine law, that it could be required for school entry for the following fall. So stay tuned. It's too soon to say, but if you're asking if it could happen, the answer is absolutely.
All right, Dr. Hefner, also, you talked about the college kids getting vaccinated. There's a lot of questions about daycares, which are a little bit more independent. When you get into the elementary school, middle school, high school, and now New York just releasing guidance for day camps. What have we seen in terms of spread when it comes to the daycares and then the younger children in the elementary, middle school, and then up to the high school level?
Right. So, it's clear that there are some differences in contagion by age. It's those, again, the information around that is still developing, but I think for all the reasons we've talked about before, this is still a highly contagious virus at any level. And when you're talking about preschool age children in daycare or school age children or adolescents, there still is a small but real risk of significant disease for them. And more importantly, the people who are attending those, the people who are running those daycares and teachers and employees at schools, I mean, those are adults who are potentially more at risk. And then there's the community, the family members, the elders in their family. I think that the vaccine philosophy for younger people really comes back to a community approach to vaccination and moving towards that broad immunity that we all desire. And it's clear that is the best way to achieve that immunity is through vaccination, not through allowing people to become sick.
And of course, there's been a lot of kids either just completely out of school or doing virtual learning for about a year now or a little bit more. Are we starting to see, or could we see an educational gap where kids aren't really getting the information that they need? There
is a gap. It's not whether or not there will be a gap. There is a gap. And I think educational professionals are acknowledging that the strategy as people return to learning will not be to catch them up, but to adapt to the changes and the gaps that have occurred, because that time lost can't be doubled up on time that is needed to do the things as they advance. So that is a huge consideration on the recommendations of returning to school, is how important and how impactful for educational purposes and mental health. Mental health issues have been tremendous in school age kids. So for all of those reasons, it's very impactful.
So are you seeing more cases of anxiety or social anxiety or depression in these younger kids that have been home for so long, away from their friends and in front of a computer?
Very much so. Very much so. It's a very big deal.
All right. Dr. Nistico, we talked about a lot of the reactions that people might get when they get the vaccine. I know when I got the J&J, I had the fever for a couple hours, but I was fine after that. Are we seeing a difference in reaction to the shot between adults and children when it comes to that Pfizer vaccine?
Right now, no. I think what's been reported, so before they had actually initiated these trials, they were looking very closely at the data from adults. And what had happened was that with the adult trials, we know that there's fever, fatigue, muscle aches. Some people can get other reactions. But with children, it's very similar. The only thing that hasn't really been reported too much of, which isn't reported at all really much in the data for adults, is the anaphylaxis. So for example, life-threatening reactions are extremely, extremely low inside of the adult population. With children, there hasn't been any formally reported severe reactions to the vaccine trials as of yet. But once again, the trials are still in early phases where they haven't gone through any approach to do any emergency use authorization or approval processes yet. But Pfizer and Moderna are both working on trying to get those vaccines safely into children right now.
All right, so where does Moderna stand with getting those younger kids vaccinated? And are we going to see the Johnson & Johnson be eligible for younger kids after we solve the issues with the blood clots in some cases?
Right now, Johnson & Johnson hasn't, that I know of, have moved forward with any really proceedings on trying to vaccinate younger children. Right now, Pfizer, Moderna have really headed the forefront of vaccinating younger people. The only thing to really note is that I think where we're going to try to see this kind of occur is it might come down to just making sure that they've enrolled enough children in the trials, seen that it is safe, and then gone to the FDA for an emergency use authorization in children. It will take time for individuals to be comfortable with the fact that they're going to vaccinate their their children, and whether or not parents or guardians are going to be comfortable with that idea. But I will say that, in the grand scheme of how we're going to approach this, like we were talking about with community spread and how we're going to protect the community and going forward to reach normalcy in the future, we really have to focus our efforts on vaccinating younger children, younger individuals, just because getting back to high school, getting back to, grammar school, getting back to social interactions, play dates, things that are very important, normal, upbringings for younger children, younger individuals. It really needs to be at the forefront, because the way that it is right now, we're noticing obviously these huge lags and obviously increase in anxiety and depression. So this is really going to be helpful, kind of, fighting that and being at the forefront of all that.
All right, Dr. Niska, real quick. We've seen issues with masks now changing. What should parents, if the parents are vaccinated, if the grandparents are vaccinated, but they have kids who are, between 8 and 14, they're kind of in that middle range, or even younger, how should they handle the masks with the kids if they're going out, or even if they're at home?
Yeah, the way that the CDC approached it early on was they gave interim guidance to note that if you are vaccinated, you did not need to wear a mask in public settings. Now, that's an interim guidance, and some states have adopted that guidance, but it's not a requirement. So, for example, mask wearing, yes, it's not a requirement, but it is recommended in some situations. Now, if you have younger children that are unvaccinated, I think it's at your discretion, but we always have to really look at the situation to say, mask wearing in the beginning, we weren't really big on mask wearing, but now we know it has helped significantly reduce other infections as well as COVID-19. So if you have vulnerable individuals at home, elderly at home, or individuals that are younger that are not vaccinated, we should still really consider the use and look at that, recommended, label as saying we should consider continuing to wear masks at this time until larger populations receive the vaccine, or we start to achieve that herd immunity where younger individuals are starting to be vaccinated in larger amounts. It's definitely something that will be a discretionary choice come the future, but I feel like mask wearing still definitely it should be apparent in some situations, especially where people are in very large crowds.
All right, Dr. Hefner, I want to ask you, what is your advice to parents who are saying they're not going to vaccinate their kids at all, whether they're against all vaccines or they're just not sure about this one because it's so new? What are you telling parents that are bringing these questions to you?
Well, I always advocate for vaccinations, especially coronavirus vaccine. It is, to this point, the research that was done leading up to, say, the 12 to 15 just showed such complete efficacy, 100% prevention of severe disease in a fairly large, comprehensive, study to get the emergency use authorization. There is always going to be skepticism, and even healthy skepticism of things, but I think our experience with vaccination over the last half century, and as we thoughtfully added vaccines over time to prevent really severe diseases, unfortunately, many of the people we're working with have never seen or experienced some of these things that are so terrible. And so it's sometimes hard to explain what that means. But I think when you sit down with folks and you talk about, you know, your experience, and you say, you know, these are things that I've seen and these are things you don't want to see in your family. I think people are often less skeptical hearing that, knowing that, you know, we give a lot of vaccines and they're very safe and they're very effective. And unfortunately, there's a handful of folks out there that really have some strong feelings about it and are very vocal and very visible, but unfortunately they're wrong. And that's been proven time and time again. So, you know, I am obviously biased because of my medical experience, but I share that bias openly, and I invite people to ask questions, and I answer them as completely as I can, and that's how I approach it.
All right, and yourself, Dr. Nisko, how are you addressing these questions with parents when it comes to the vaccine?
I think that the approach, like we were saying, I think it's very important to note that, you know, historically vaccinations have, you know, helped our society tremendously by eradicating certain types of infections that we don't necessarily deal with now at all. What's important is that, you know, to know situations is that COVID-19 is an extremely contagious, aggressive, and deadly disease. And that if we were to say, you know, vaccinate population and try to eradicate this, we could start to see, you know, or move forward. And it's much safer to consider vaccination than to consider, you know, risk of infection. The last thing you want to do is deal with very, very severe complications in younger folks or younger individuals, you know, or even yourself, you know, getting sick. And really, as more and more people are vaccinated, it's not only helping that individual person, but it's helping all the people around them. And so it's really an important point just to make that the more people that do it, the better the benefit. And so it's just an extremely, extremely, extremely important aspect. And I agree, I'm extremely biased to say that I, you know, tell everybody vaccinations are highly safe, highly effective, and really it's the science that has proven you know, time and time again that we can get past these severe infections and this pandemic by vaccinating individuals.
All right, Dr. Justin Nistico from Arnett Health and Dr. Philip Hefner from Guthrie, thank you both for joining us today. And viewers, again, if you have any more questions regarding COVID-19, we'll keep addressing them here on State of the Virus. Of course, 18 News will have more coverage of the fight against COVID-19 and the increase of vaccinations across the country. So thank you for joining us and have a good night.